myself Ruti Reddy. I am from 3rd year BPD. Today I am going to explain you about cerebral palsy. So that's a group of permanent disorder attributed to a non-progressive damage to infant or fetal brain that affects development, posture and movement, which causes activity limitation. So its etiology can be identified only in 50% of the cases. So the time frame of the brain injury is prenatal, perinatal and postnatal period. So what is prenatal period? It's a conception to the onset of the labor. Perinatal second, it's 28 weeks intrauterine to 7 days. And now postnatal period, that is first 2 and some of the 5 days after the birth. So now cerebral palsy is the most common motor disability in the childhood. The etiology of the cerebral palsy is very diverse and multifactorial. The causes are maternal infection, stroke, bleeding into brain, infant infection, traumatic head injury, lack of oxygen. So first, maternal infection that affects the unborn baby. Second is stroke. Stroke means which interrupts the blood supply to the developing brain. Bleeding into the brain, into the womb as a newborn. Infant infection that is causing swelling around the brain. Traumatic head injury and infants such as from a motor vehicle accident, fall or a physical trauma. Lack of oxygen that is brain related to a hard labor or a delivery, although this cause is less common than the stroke and the maternal infection. 75 to 80% of the cases is due to prenatal injury, which is less than 10% being due to significant birth trauma, that is apheresis, that is unable to breathe. So now the risk factors which we have written here: prenatal period, perinatal period and postnatal period. So for the first, that is prenatal period, there are prematurity, low birth weight, maternal epilepsy, infections, bleeding in the 3rd trimester, severe toxemia, eclampsia, drug abuse, trauma, multiple pregnancies and placental insufficiency. For the second, that is perinatal period. For that, prolonged and difficult labor, premature rupture of the membranes, presentation anomalies, bradycardia and hypoxia. For the third, that is postnatal, that is from 0 to 2 years of age, there will be CNS infection, hypoxia, seizures, neonatal injuries, that is head trauma, etc. Then there is signs and symptoms for the cerebral palsy: abnormal behavior, excessive irritability, poor eye contact, poor sleep, poor mobility, grimacing, persistent bite, tongue retraction, frequent vomiting, abnormal tone, poor head control and hand preference before 2 years of age.